Guys, welcome back to my new video. So I know I'm late, so sorry for the delay. I was trying to make videos as soon as possible, but yeah, it took so much time, so sorry for that. So without any further delay, let's get into it. Hello Mr. I'm your Dr. Rosy Sign. Can you please tell me your name and age?
I'm Pradeep and I'm 19.
Okay, so today I'm gonna examine your stomach.
Okay.
So is that okay for you?
Yeah, it's okay. No problem.
Okay, so before we start, can you please go to washroom and pee?
Okay.
Thank you. So first tell me if you feel any kind of pain in your stomach area. No? So that's fine. Now we will start your examination. So first, can you please lie down here? First step is you will tell the patient to pee. I mean, go to the comfort room and just empty your bladder. Okay. The first step would be this in the abdomen examination. And the second step is you will take the history, and that you will ask normally, generally for the pain, if the patient is feeling any pain in the stomach area. So after that, you will go to the right side of the patient. Always remember, abdomen examination is from the right side of the patient. Okay. So the next step would be you will drape the patient. So from where to where? So you will. Okay. Till the nipple line. Okay. You will drape the patient till the nipple line. Okay, just relax it. And here is pubic symphysis. Okay, so here is pubic symphysis. So the abdominal area is visible now, and you can just inspect. You will start with the inspection. So in the inspection, what you will do is there is no scars, there is no herniation of the umbilical, or there is no dilated veins, there is no stretch marks, or there is. And what you will inspect is you will put the light on the abdomen area, and you just try to see the peristalsis movement. Okay, so in the thin patient they are visible, you can see the peristalsis movements, and that's all. In the inspection, that is it. You will tell the doctor the shape of the abdominal area is flat or it is globular. Whatever you are seeing in the inspection, you just tell the doctor. Okay, so we are done with the inspection. Now we will do the auscultation first. So for the auscultation, first of all you will do the auscultation of the 4 quadrant. You will use your diaphragm of the stethoscope. First you will rub on your hands to warm it up so that patient won't be discomfort. And now you will place on the 4 quadrants for the 15 seconds. Okay, so we are done with the auscultation. So why do we do auscultate? So we do auscultate to hear the bowel sounds, so which is gurgles and clicks, and the normal frequency of the bowel sound is 5 to 34 per minute. Okay, so you will auscultate for the 15 seconds, and you will count the frequency and tell the doctor it is per minute, like 18 bowel sound per minute. Okay, so now we will auscultate for the liver and spleen to check if there is any friction rub or not. So you should know the location. Obviously you know where the liver is and where the spleen is. So you will place the stethoscope just below the costal margin or just over the costal margin or sideways. And for the spleen, sixth intercostal space, anterior axillary line, and you will just try to here for the friction rub. So upon auscultation there is no friction rub of the spleen and liver, so it seems that there is no hepato and splenomegaly. Now I will auscultate for the aorta and arteries. So the aorta is in the epigastrium area. So you will place your stethoscope between the intercostal margins. Okay, now the renal arteries. On both sides. Now the umbilical artery, which is lateral to the umbilical and just below it on the both sides. And we don't do for the femoral arteries. Okay, so why do we auscultate the aorta and arteries? So we try to hear any abnormal sound like bruits. So what is bruit? Bruits are abnormal sound of the blood flow. Okay, so we are done with the auscultation. Now we come on the percussion. So first we will percuss the four quadrants. So the quadrant is divided into four, which is, this is umbilical line and like this. So this is first quadrant, second, third, fourth. So this is right upper quadrant, this is left upper quadrant, this is left lower quadrant, this is right lower quadrant. So you will percuss first four quadrants general. Okay, twice in a quadrant. Okay, upon the percussion, the percussion note would be tympanic, and that is normal. Okay, so now you will percuss for the liver. So for the liver, you will start just below the nipple and mid clavicular line, just below the nipple and mid clavicular line. Okay, okay, so sound would be changed from the resonance to dull. Okay, where you find or where you feel that yeah, this is dullness, you will stop there and you will mark that place. Okay, and keep in mind that here is dullness started. Okay, and now you will start from the umbilical line, mid clavicular line to upward. Okay, so you will start from the here, and this sound would be changed in the tympanic to dullness. So where you feel there is dullness, you will mark that and you will count that what is the distance between where you checking for the liver span. So the normal span is 6 to 12 centimeter. Here I got is 8 centimeter, that is normal. Okay, now we will percuss for the spleen. So for the spleen, you will start, so nipple is in the fourth intercostal space. So just below the nipple is fifth intercostal space, and this is sixth intercostal space. So you will start from the sixth intercostal space towards anterior axillary line and and then you will go downward. Okay, so from the 6th intercostal space, go towards the anterior axillary line, and then you will go downward. So upon the percussion of the spleen, the sound would be, percussion note would be tympanic. If you feel there is dullness, then the sign is splenomegaly. Okay, so we are done with the spleen percussion. Now we will do the palpation. So first, there are two palpation. First is normal palpation, and then the second is deep palpation. So first, light palpation. Why do we do light palpation? To check if there is any pain or not. Okay, so light palpation you will do in the 4 quadrants and ask the patient if he feels any pain, and try to look on the patient expressions, because if you will press here, patient will feel pain and he will change his expressions, so it will be helpful for you. So we are done with the light palpation. So upon the light palpation there is no pain or no tenderness. Now we will do the deep palpation. Why do we do deep palpation? To check if there is any extra mass or tumor is present or not. Okay, so you will do deep palpation in the 4 quadrants. So remember, first we will instruct the patient to go to the washroom and empty his bladder. We tell because we don't want that patient feel any uncomfortable while deep palpation. If the patient bladder is full, then you can't do deep palpation. Okay, so upon the deep palpation there is no extra mass or tumor. So we are done with the palpation. Now we will palpate for the aorta. Okay, so for the aorta, first you will just try to feel the impulses coming out from the aorta. So you will place your 2 fingers, or you can place your fingers like this in the epigastrium area. Okay, now you will check for the diameter of the aorta. So for that, what you will do is, this is costal margin, and you will place your hands like this, and try to feel the impulses on both the fingers, on both hands of the fingers, and just the note diameter between your these two hands. So this should be 2.5 centimeter normally. If you feel more than that, that is abnormal. Okay, so we are done with the palpation of the aorta. Now we will palpate for the liver. So for the liver, you will just lift the patient on your hand. Okay, just relax on my hand, and now tell the patient to take a normal breath and then full exhale. Okay, so take a normal breath and then full exhale, full breathe out, I mean. Okay, now can you take a deep breath for me? Okay, just relax. Okay, so for the liver palpation, first you will tell the patient to exhale first, and then you will place these fingers in the costal margin, and then tell the patient to inhale, so that when patient will inhale, the liver edge will be felt by your fingers. Okay, so the characteristics of the liver is, the liver edge is sharp and movement is smooth. Okay, so now we will palpate for the spleen. So for the spleen, you will lift the patient and just relax on my hand. Okay, now can you please breathe in for me full? Okay, so not just below the costal margin, you will maintain distance, and then you will place your fingers deeply. Okay, now just relax. Okay, if there is any splenomegaly, then the tip of the spleen will be in your hand during the expiration. So during the palpation of the spleen and liver, there is no hepatomegaly and there is no splenomegaly. So in normal palpation of the spleen is not palpable because it is deep down to the costal margin behind the ribs. That's why it is not palpable. So we are done with the palpation of the spleen and liver. That's all. Okay, so we are done with the examination of the abdomen. So now there are some special techniques to know if there is any abnormality or not. So first we will check for the ascites. Ascites is fluid in the abdominal cavity. Okay, so how we will know? First I will check is fluid wave. Okay, so for the fluid wave, what you will do is you will tell the patient to, okay, so can you please do like this for me, sir, on your abdomen? Yeah, like this. Okay, just firmly keep pressure. Okay, so now the patient is in this position, and now you will place your hand like this and you will tap and try to feel the wave. If you can feel, if you feel the wave, that is sign of ascites, and if you don't feel the wave, that is normal. And why do we keep hands like this? Is there is adipose tissue, so we don't want that the waves pass through the adipose tissue. That's why we keep the hands like this. Okay, now the next is shifting dullness. So for the shifting dullness, this is umbilical and this is umbilical line. So you will percuss on the umbilical line. Okay, till down. Okay. So after the percussing, percussion you will start from in this area. You will start from here to end. Okay, and then you will tell the patient to take a side. Okay, can you please turn on your left side? Yeah, like this. And again, okay, just relax your hand back. हाथ तो सीधो क्यों रखे? हाथ एकदम रिलैक्स रखना, नीचे पड़ी रहियो. Okay. Now can you turn on your left side? Wait. Okay. And again you will start to end. Okay. Till here. Okay. Just relax it. So in the so when you are checking for the shifting dullness, what you will feel is in the upper area of the abdomen, you will feel the percussion note is tympani, and whenever you will go downward, you will feel the dullness over here. Okay, so when you will change the side of the patient, the fluid will shift towards this side, and then you will again percuss from here. So at that time you will feel the tympani sound over here, because first there was dullness and now you will feel the tympani. That means the positive sign for the ascites, shifting dullness. And now I will perform the special technique for the appendicitis, inflammation of the appendix. So first I will perform is Rosy Sign. So for the Rosy Sign, what you will do is you will press in the left lower quadrant of the patient and just let me know if you feel any pain. Okay, so when you will perform the Rosy Sign, you will press deep. At that time patient won't feel any pain, and when you will remove your fingers, at that time patient will feel pain if there is positive sign for the appendicitis. This is Rosy Sign. Now I will perform is psoas sign. So now I will apply pressure on your thigh, right thigh. Just try to raise your leg. Okay, just raise your leg. Do you feel any pain?
No.
Okay. So during this maneuver, patient doesn't feel any pain. That means there is no appendicitis. Okay. Now I will perform the Obturator Sign. This is least among South and Rosy among these. So for the obturator, what you will do is you will flex the patient knee and you will push medially and ask the patient if he feels any pain. Okay. So patient doesn't feel any pain over here. That means there is no appendicitis. And we are done with the appendicitis special techniques. Now I will perform the last one, is Murphy's sign, to know if there is inflammation of the gallbladder, cholecystitis. So for that, what you will do is, okay sir, just relax. Okay, just relax. And you will hold the patient from the costal margin. Okay, take normal breaths. Okay, and you will press inside deeply. Okay, and then you will tell the patient to breathe in. Okay, can you breathe out, breathe in. Okay, so during this maneuver, what you will notice is, if there is cholecystitis, patient will suddenly stop breathing. Okay, during this maneuver, if there is cholecystitis, otherwise patient can breathe in and breathe out normally. And if there is cholecystitis, patient will suddenly stop take breathing. Okay, so we are done with the abdominal examination. Okay, so in this today's video we did the abdominal examination. So in the abdominal examination, the things you should know is, first of all, the introduction is must, and then you will tell the patient to empty his bladder. The first step would be this. Okay, and the second step would be draping of the patient. When patient comes again to the comfort room, and then you will tell the patient to lie down and then drape the patient. And after the draping patient, you take a note. Remember always that the abdominal examination you will perform from the right side of the patient. Okay, so after going to the right side of the patient, then you will start your examination. First of all, you will start with the inspection. So in the inspection, normal points for there is no scars, there is no swellings, there is no atrophy, or there is no stretch marks. That's all. Keep in mind the content, what you are telling the doctor. Okay, and after the inspection you will do the auscultation. So why do we do auscultate first? We don't want to disturb the bowel sound of the patient. So if you will do the palpation first, then the bowel sound will be changed and you can't be here anymore. That's why we do the auscultate first, and then you will do the auscultation. So when you are performing auscultation, first you will do the auscultation of the 4 quadrants, and then you will do the auscultation of the aorta to hear any abnormal sounds like bruits. What are bruits? Bruits are abnormal blood flow, turbulent blood flow. Okay, so and then you will auscultate the liver and spleen. Why do we auscultate liver and spleen? To check the friction rub. Okay, so we are done with the auscultation. Now we will move on to the percussion. So first you will percuss the 4 quadrants twice in 1 quadrant. Okay, so after the percussion, then findings of the percussion would be, the normal percussion note is tympanic, so that means that is normal. Okay, so why do we do percuss? To check the gas in the abdominal area, how much gas is there. Okay, so after the percussion in the percussion we percuss for the liver also, to check the liver span, I mean size of the liver. Okay, so the liver and spleen. Why do we auscultate for the spleen? To check if there is splenomegaly or not. Okay, so we are done with the percussion. Now we will move on to the last step, which is palpation. First we will do the light palpation. Why do we do light palpate? To check if there is any tenderness or pain on the light palpation. And then we will do the deep palpation. Why do we do deep palpate? To check if there is any extra mass or tumor or present or not. Okay, so general palpation in the 4 quadrants, so there is no pain and there is no extra mass. And then you will palpate for the aorta. First you will just try to feel the pulses on your one hand, and then you will place your both hands with your fingers in the abdominal area where the aorta is, and just try to feel the pulses of the aorta on your both fingertips. Okay, and take a note of the distance, diameter, which is normal 2.5 centimeter, and if that diameter is more than 2.5 centimeter, that is abnormal. Okay, so after the palpation of the aorta, we will palpate the liver. So for the liver, same, you will hold the patient, patient will relax on your hand, and then you will place your fingers on the full exhalation, okay, full breathe out, liver palpation, and then you will tell the patient to take a deep breath, and when patient will take breathe, at that time you will feel the liver edge on your fingertips. And the characteristics of the liver edge is, the liver edge is sharp and the movement is smooth, normal. And then you will palpate for the spleen. So for the spleen, same, patient will rest on your right hand, and then tell the patient to deep breathe, take a deep breath, and in the inhalation you will place your fingers not just below the costal margin, you will maintain some distance, and then you will place your fingers deep, and then just when patient will exhale, at that time you can feel the tip of the spleen if there is splenomegaly. Okay, so spleen done. Okay, so we are done with the palpation and we are done with the abdominal examination. So lastly is special techniques. So first we perform for the ascites. Ascites is fluid filled abdominal cavity. Okay, so we check to know if there is ascites or not. So first is fluid wave. So for the fluid wave, you will tell the patient to keep his hands like this, okay, and then you will place your one hand in the left flank area, and then you will tap on the other flank area and try to feel the wave on this side. If you feel the wave, that means there is ascites, otherwise no. Okay, the next is shifting wave, shifting dullness. So for the shifting dullness, you will percuss from the umbilical line till the end. Okay, same, percuss, and on the superior area you will hear the tympani sound, and when you will go downward you will hear the dullness if there is any ascites, and then you will tell the patient to move, take a side on the left, and then you will again percuss, and during that time you will feel the tympani sound. If you feel first dullness and then tympani, that means the positive sign for the ascites. Ascites, now we will perform for the appendicitis. First is Rosy Sign. So in the Rosy Sign, what we will do is, you will press deep in the left lower quadrant of the patient, and when you will remove your hand, patient will feel pain. So it is called rebound tenderness. So this is positive sign for appendicitis. Now the next is psoas sign. So for the psoas sign, what you will tell the patient to, you will apply pressure on the thigh of the patient, and you will tell the patient to raise his leg. Okay, and during that time patient will feel pain on the appendix. So that is positive sign for the psoas sign. And the last is Obturator Sign. In the Obturator Sign, the technique is there and patient will feel pain. And the last is Murphy's Sign. So in the Murphy's Sign, you will hold the patient like this on the costal margin, and then tell the patient to take a breathe. And when patient will take breathe, he will suddenly stop taking breathe. This is positive sign for Murphy. So that means the cholecystitis is present over there. So that's all. We are done with the abdominal examination. Thank you so much. I hope this is helpful for you. So hit the like button and subscribe to my YouTube channel. I will make videos soon as possible. Thank you so much.